A very good morning. Thanks for joining for our virtual conference on the pressing issue of how the NHS can invigorate its workforce. Welcome to new faces here for the first time, and hello to those of you who join us regularly for these conferences, packed full of useful content. The National Health Executive is always keen to deliver content which inspires innovation on the platform long after the event has finished. Today will be no different. It will be full of opportunities to network and acquire industry knowledge and best practices from other NHS professionals. So I hope you're looking forward to what we've got in store. To access the on-demand material, just go to events.nationalhealthexecutive.com/on-demand. That's quite a mouthful, that one. A big thank you to the industry leaders and experts who've taken time out to join us to share their high-quality insights. Due to the standard of content that's going to be shared on our NHE 365 platform, it's worth pointing out that it's CPD certified. So for every hour you watch live, you'll earn 1 CPD point. Your CPD certificate will be with you within 24 hours after the conference has ended. Our networking opportunities can be accessed via the speed networking function, and I encourage you to collaborate with your colleagues as another valuable source of education. This all plays a part in the community we're growing to extend the reach of knowledge and connections shared today, which can be accessed at any time to fit in with your busy schedules. Also on the NHE 365 platform, access to a wealth of resources on our on-demand content section alongside the digital marketplace, providing expertise for you and your teams to digest at your leisure. Finally, please do feel free to share your thoughts and experiences today across social media using the hashtag NHE365. So without further ado, let's get started. 1.2 million people work full-time for the NHS in England across hospital and community services. But there are workforce shortages across all staffing groups, which is putting significant pressure on current NHS staff. The workforce is widely regarded as the greatest challenge facing the NHS. The issues are multifaceted and stem from things like an increasing demand for services, our ageing population, financial constraints, and staff supply and retention. Many staff feel burnt out and exhausted, which can affect patient safety and, of course, their own mental well-being. And as we know, some staff are involved in industrial action, which causes problems like disruption to elective care. Creating a sustainable workforce and meeting the government's manifesto in the long term includes training and recruiting more nurses, GPs, and other health professionals. The government has brought in bursaries to support the new generation of nurses, and this financial support is to help with living costs students will face, as well as introducing more medical training facilities. NHS managers need to effectively recruit for their teams, identify training and development needs, manage the workforce efficiently, and balance the resources available to them, as well as protect their team's mental and physical health and rights, which has been established as part of the NHS long-term plan. So with that, I'd like to introduce you to our opening keynote speaker, Caroline Waterfield, the Director of Development and Employment at NHS Employers. Caroline, a warm welcome to our virtual stage.
Thank you so much, Helen. That was a really comprehensive run through and a setup for the day. And I'm super envious of your roses behind. I had some downstairs at the weekend, but it was so sunny here up north, which isn't usual on a bank holiday weekend, that they haven't lasted quite as long as yours. They didn't look quite so fresh this morning, but great to be into the springtime and the warm weather out. So welcome everyone. As Helen said, I'm Caroline Waterfield and I'm the Director of Development and Employment at NHS Employers. And we do a lot with our employers around recruitment, and what I wanted to do today was give some reflections on some of that, but also touch on some of the things which Helen's talked about. Because it's a vast subject, and we know we keep recruiting, but we also don't always give the best experience to some of the students that we are recruiting and training, and some of those people haven't stayed, and some people, and we can see this from the recent NMC report that came out, some people with the context and the environment in which we're working in are finding it a really difficult place to continue to work even though they'd like to. So I'm going to talk about recruitment a little bit and supply and the importance of the long-term plan, but I'm also going to kick off by focusing a bit on staff experience, because that's really critical that we get that right if we're going to get the recruitment right long-term and going forward. So the three things I'm going to give some reflections on are staff experience, workforce supply, and then the long-term workforce plan. And as Helen's alluded to, it's no doubt it's tough. Sustained high demand in all parts of the sector. We've had a really emotionally draining few years through the pandemic. We were starting to see increased wait many patients, and that's increased. We've had external to the sector inflation sending prices up, and that's hit everybody's pockets. We've had industrial action in sector, and some of that's yet to be resolved. So for everyone who's listening today who plays a part in delivering that health and care, I just wanted to start by saying thank you, that you and all of our staff do a great job, and it's up to us around that to try and make the environment as good as it possibly can be. But it's been increasingly clear over the last few years that additional investment has and is needed to help move staff back into a place where they feel able to do the job that they want to do and to feel that they're doing the best for patients. Because when we're not able to do the best that we can for patients, either we don't have the right amount of time that we'd want to give people, or the resources, or we feel stretched, that understanding becomes really difficult. And the longer that goes on for, the more distressing that can be. So I'll come back to why the long-term workforce plan is important for that particular point a bit later on. But as well as investment, looking at some of the fundamentals of good employment practice and staff experience is really critical in supporting all of our staff to have a good or better experience at work. And that's important because we know from studies that it makes a difference to patient experience. So higher staff experience scores and levels equals better patient experience. And some of those fundamentals that we've been looking at and some of our employers have been feeding back on with us as they've been working on some of this are things that seem small, seem simple, but make a huge difference in people's daily working lives. So that's making sure that people get breaks on shift, that they have access to food and drink, and that that's relatively close by and easy accessible to where they are working. That the working patterns are predictable. So we talk a lot about flexible working, and that's super important, but predictability is equally as important. And predictable working patterns means that when you come into work, you have an idea about when your shift will be finishing, but also for the week ahead and the weeks ahead, you know what that shift pattern looks like. And there may well be some flex, but on the whole, people know what it is that they're coming to work to do, and then also when they're coming to work. And some of this sounds really basic, but the level of control of an autonomy that people have to manage both work and then outside of work commitments is essential. And when that isn't there, that becomes difficult to manage. Then we've got small things around recognition and gratitude. And this isn't just about managers saying thank you or sorry to colleagues in the team, but it's also that recognition and gratitude towards us, so there's others in the team can make a huge difference. And we know from the staff survey results that came out in March that were taken at the back end of 2022, actually that score for the way people feel about their line managers had been sustained throughout the last couple of years and had increased. So people did feel supported and recognised and valued by their manager, and that's really important. It's really important to hold on to, and the small things that make a difference there. Then we've got something, I suppose, that takes for some people a little bit more courage, and that's about respectfully challenging when we see discrimination, whether that's racial discrimination, sexism or misogyny in the workplace. And there's been a lot of work, particularly through the Women's Leader networks that exist, about being an ally. So being an ally is good and it's great. Being active and being not just a bystander, but an active bystander to ensure that all colleagues have equity in the workplace would be even better. So that's my 1, 2, 3, 4, 5 things. So my sixth thing and final thing on this list is managers looking forensically at the pathways, wherever you are in the sector, with the aim of reducing hurdles and barriers that enable staff to do the job and do the job well. And we all know that we've got those little frustrations in work. And I know that a lot of work's gone into looking at pathways, but keeping an eye on what's going on at each handoff point and seeing if there's anything you can do to remove or change or smooth those pressure points to reduce the pressure and workload that people experience at work. That might also apply into the training experience that students and trainees have, so that they can get the best possible experience while they're in that training place with us. So for most of those things, they're really small, but they have a huge impact. So my message to anybody out there listening now or listening on catch up later is focusing on the small is really important, as well as the big, and we'll come on to the big in terms of funding and investment and the plan shortly. So increasing supply is one of those big ticket items that referenced at the beginning. And over the last decade, there's been an awful lot of focus on increasing the workforce, but I'd say specifically increasing the nursing workforce. There's been an introduction of new roles. So we've got the nursing associate role that was introduced a number of years ago, and increasing numbers coming onto the NMC register. We've had nurse training expansion, both through the university courses, but also an introduction of the nursing degree apprenticeship as a route to achieve your registration. And those have had smaller numbers in recent years and then are growing. We've had a focus on retention, particularly again in the nursing workforce, and a focus on international recruitment in the nursing workforce. And within that particular part of international nurse recruitment, so there's been a heavy focus on the adult nursing as opposed to other forms of nursing, smaller numbers of nursing in mental health, children's mental health going into community have come from overseas. And that international recruitment bit has gathered quite a lot of attention in recent years. It's always been an element, and it's always been part of local strategies, regional strategies, sometimes part of a national strategy like it is now. But we've seen a lot higher number coming through those international routes in the last 5 years. And we would expect to see that continue for the next couple of years to come. If I flip back to the retention, and it links to the staff experience bit, there's some experience that we've had through some of the work that's been done both nationally, regionally and locally, where we've got themes where it's been important to, I suppose, put the foot on the pedal in certain areas. So we've got work around supporting new starters. So once people have trained and they join the workforce, how do we make sure that we nurture them through preceptorship and their early years of work as opposed to training, and particularly in the last few years where people have had a different experience through the experience, things that they would have never experienced before, but other experiences they haven't had. So what they're coming into the workplace with for many people is slightly different. So needing to adapt that to tailor to need is important. Once you're in post, that career progression piece. So what does that look like? Where do I go next? How do I gain experience? To different parts of the organisation, different parts of my system, different parts of the sector. It might be into education or to research later on in career, but how do we make sure that people have access to that career advice, development and opportunity to progress? The flexibility and predictability part, and I touched on predictability before being important, but that enabling people at different parts of their careers to be able to flex and adapt to what's going on outside of work to inside of work. Those things become really challenging when you don't have enough people on the ground. But it's also really important to try and understand where, if there are flexibilities that we can offer people, that we look at what those are and try and accommodate. And I know there's an awful lot of work that's gone on over the last few years in trying to support that. And then the final bit of the retention piece is around retaining our more experienced workers, and different ways. Some of that's about flexibility, some of it might be about the roles that people undertake, how they might supervise newer qualified staff or students in a different way. So there's an awful lot of work that's happened. Examples that we've got on our website and in our retention guide that people can have a look at. So the retention piece and then international recruitment bit are both active work streams, and we would say will continue to be important and active work streams going forward. The nurse training expansion, I think, is an interesting one, because we decide to put some investment and how much energy we can put behind how we can perhaps do training differently to support an increase in the training that's needed, both through the university route with placements and through more apprenticeships being available to people. And the reason why we particularly feel that the apprenticeship route is a really important route for people is it's great for supply. We know that people who are in our workforce, perhaps as healthcare assistants or as nursing associates or support workers, would really like to progress, would like to develop, and can have the opportunity through the apprenticeship route, doing 2 years of training and then perhaps another 2-year top-up, or doing the straight 4-year nurse degree apprenticeship route. It's great for existing staff to be able to progress. It's also great for new staff coming in who might not have chosen the university route. But we also know that there are some issues with both navigating some of the policy and also the upfront funding that these routes take. And when we come to the plan, in a moment, I'll be trying to flag that there'll be things that we will want to explore, try and break down those barriers to, if we want to make these routes viable long term, there are things that we need to make sure happen. But some of those longer term solutions could be apprenticeships if we can get some of that right, increasing training places, and then matching that with the investment in the infrastructure that's needed to train people and train people well, give them that good training experience and give good proper time to supervision and mentoring for people through their training programs. And then the investment in digital and tech as enablers, both for the workforce, but also for patients. So how do we do things differently there? And then also making sure that this isn't just about either acute hospital settings or NHS settings. This is about the whole of health and social care, and thinking about what do we do with primary care as well as social care, because without looking at that whole system, it's difficult to improve the whole pathway and experience for patients, and therefore then we'll have bottlenecks in the system, which will then put pressure on staff in particular settings. So those longer term solutions, particularly around recruitment, we see as the apprenticeship route and increasing training places. I've talked a lot about nursing because actually that's what a lot of the national focus has been on in the last few years, but we also know that that's been potentially, at the expense of other professional groups where we know that we've got gaps, and that we know that we've got pinch points in delivering both joined up care out in the community, but also integration of care and services. So if we want to really think about how do we address prevention, how do we deliver that joined up care in the community, how do we deliver on rehabilitation in a different way, the nursing workforce is really critical, but so is our allied health professional workforce, so are our scientists, so are those who contribute to delivery of diagnostic services, and thinking about what does that look like and where does the investment go to support that part of the training and recruitment will be really critical if we're going to deliver on the 4 aims of the ICS model, and really think about how do we improve population health and reduce some of the inequalities that exist in our workforce. And at the moment we're very much focused on the sticking plaster to where we've got some big vacancies and gaps in the nursing workforce, and that's important to fill, and it's important to think about and what next. So then finally, that takes me on to why the long-term plan is so important. And this is something, the long-term workforce plan, I should say, is so important. We've been calling this as an organisation for some time. And of course, local organisations have their own plans, they have their own workforce strategies. You know, a couple of years ago, we had the NHS People Plan and the NHS People Promise. And that set out a range of actions and expectations on staff experience, and you could not argue with anything that was in there. And there was lots for organisations to do and take forward, but it was missing some fairly critical content around supply, numbers, whether or not we were training enough to be able to meet not just current demand, but medium-term demand and long-term demand. And that's why the long-term workforce plan is really important from our organisation and our members' point of view, because we haven't seen that national workforce plan that's got numbers in it published, which sets out where we are now, what we might be needing in 3, 5, 10 and 15 years time, and what might this look like, and for that plan to be driven by what's going on in demand in local areas. So the information, the intel comes up, and the plan has been formed through all of that intelligence and data, and then accepting that there's a number of different factors and external environmental factors that we would want to accommodate, and that's a complicated piece of work, but a really important piece of work. And we can have the plan published, and then the really critical bit is, and where are we going to put the funding to support prioritisation of growth in particular areas. So while we know that we've got some outstanding issues still within the nursing workforce and the medical workforce, areas in mental health, in community settings, in allied health professional roles and healthcare science roles. If we want to see some of the service delivery move forward in the way that we do, then the investment needs to be able to support areas of that workforce to be able to deliver on that for our patients. So the plan needs to set out what funding is available to prioritise workforce growth. We absolutely need to address the inequality and where that money goes, and it has to help us to achieve on the aims of improving population health and reducing health inequality. So finally, recruitment's essential, but there's only so much that we can do if we're in a hamster wheel of recruit without a plan of what we're trying to recruit for, what we're trying to aim for in terms of a service, and making sure that the money and the finance is there to support that. And we've got an idea about what we're prioritising and why, so that we can have an open conversation on things where we might not be able to invest some of that money and what the implications will be to be able to manage that. But otherwise, we'll be sort of drifting with sticking plasters at a point where we're trying to really improve the staff, the experience work, and having a plan and an idea will really help us and help our employers to understand how they can manage some of that in a better way. So absolutely staff experience at a local level with some of those fundamentals to try and improve the experience how people have at work, to retain them in the workplace, keep on recruiting, keep recruitment strategy at a local level moving. So we've got international, we've got people coming through university, we're recruiting people from our local communities, and we're seeking to develop and enable them to progress. And wrapping around that, a long-term workforce plan which provides both the policy direction and funding to help give that longer-term direct. More people will come and things will get better in the workplace. And on that point, Helen, I'm gonna pause and hand back to you.
Already kind of fully out, so they were in the supermarket for £4. Caroline, thank you very much for starting us off with such a great keynote and leading us so beautifully into our first panel discussion of the day, which focuses on recruitment in partnership with Olio. The total number of vacancies in the NHS hit 132,000 in 2022, and the gap between supply and demand for employees has significant impacts on the NHS, especially with backlog, patient safety, as well as staff wellbeing and retention. So on this panel, we'll be looking at how the NHS can maximise the effectiveness of its recruitment to help reduce the massive vacancy backlog. Ensuring candidates going through the process have a great experience increases the chances that employment offers will be accepted. What are the challenges NHS recruiters face when recruiting from a dwindling pool of talent amidst competition from private healthcare? How can the NHS attract the right people for the many vacancies? Should the NHS rely on outside agencies to meet the demands? And how can the recruitment process be modernised and streamlined to bring in the right candidates quickly? It's always more rewarding for me when our discussions are a conversation with you involved. So for these panel discussions, do use the Q&A function on the right-hand side of your screen, stating who your question is for. So let me introduce you to our first guests. We have with us Samir Khalil, Director of Olio PLC, Lisa McIntosh, HR Business Support Manager at the Scottish Ambulance Service, Will Lane, Deputy Director of Operations, NHS Workforce Alliance, and Nihar Shambhavnekar, Economist at the Health Foundation. So I always get to the point on these panels where I put my glasses on and just check that I've got a full house. So it's always great to see everybody here. Welcome to you, and thanks for taking time out of what I know are busy schedules to take part in this for us. Samir, maybe start off with you. What are the challenges that NHS recruiters face when recruiting from, as we've said, a dwindling pool of talent amidst such stiff competition, and also, including from private healthcare?
Hi, thank you very much. Can you guys all hear me okay?
Yeah. We can.
Well, I think, we only have 20 minutes to talk about this thing, so I'll go straight to the point. I think if I were to sum things up, bearing in mind, if we look at the NHS compared to other organizations who all face similar challenges. I mean, the war for talent is on everywhere all around the world. I would say the biggest thing that differentiates the NHS is that it seems to have evolved in some sort of a bubble where the NHS has been essentially using very consistent technology for quite some time that has been sheltered from competition. Not that many providers acting in the NHS space means we're essentially looking at an industry where the NHS is trying to compete with outside world recruiters with one hand tied behind its back. So in my view, we tend to see things that have been adopted by other recruiters out there. And we don't have to look at big global banks. Any recruiter in the private sector world are using tools that the NHS has still not adopted yet. And that, to me, from technology perspective, is the biggest challenge, the biggest thing that I would like to see change going forward.
Will, tell us what you see as the main challenges facing workforce management right now.
Yeah, good morning, everyone. Thank you. For those of you who don't know, the NHS Workforce Alliance is an NHS organisation that provides access to a contingent labour workforce for the NHS. So that does include international recruitment that we heard a little bit about this morning from Caroline. It does include agency staffing, which is still quite a significant part of the NHS pay budget. And it does, of course, include staff bank management and various other things. I think that Caroline expressed extremely well what the challenges are facing the NHS and what the opportunities are as well. I think that one of the things that we find that we're able to do, and in some respects the development of ICBs and deeper local collaboration in the English NHS in any case, is helps this, is to get better at planning your demand for contingent labour and to develop stronger relationships with capable suppliers and with the workers themselves. And I pick up the point that was made earlier about technology, and a lot of that has to do with really understanding at an individual trust or an ICB level what your own data is telling you about how you're rostering, where there are gaps in the roster, where you end up with emergency demand patterns, and all of that kind of thing. There is scope, I think, even within the current constraints of the NHS workforce to do some minor things that would help with improved deployment. And we've seen that has happened with a number of the trusts that we work with. So I do think that it's got something to do with understanding your demand, relating that to data, building strong relationships in your NHS region and with your supply base. That seems to me the obvious kind of first steps.
Yeah, data is so important. Lisa, just a chance for you to sort of open up with, the biggest problems you're facing in the organisation where you are right now. And, are you seeing the same sort of things as Will?
Yeah, absolutely. I suppose we're a little bit unique in that I'm talking from an ambulance service and a Scotland-wide approach. So it is slightly different to some of the other NHS boards or trusts in the rest of the UK, but the challenges are the same, I think, across the board, aren't they? They just have a slightly different spin on them. I guess what I often find is that we do have this limited skills pool at the moment, and it feels a little bit like we're robbing Peter to pay Paul quite a lot of the time, that actually we're competing with ourselves in order to address the shortages that we have locally. So that's not just the Scottish Ambulance Service, for example, versus the rest of the UK. Even within Scotland, we find that we have much harder to recruit areas. It's very difficult to get people to move there. So actually, are we trying to encourage people away from certain areas of our own organisation to fill gaps in other areas? It's quite complicated when you start looking at that kind of thing. I think another, to kind of take the technology point, I suppose, on a little bit, I think it's just generally about innovation, isn't it? Certainly I find that we still have a very traditional recruitment process that's probably been there for many years, and it works, everyone understands it, but actually, is it good? Is it effective? Is it serving us now for what we need? Probably not. And I think although we're innovative in other areas of the NHS, I do think in corporate services or support services we tend to lack that innovation. That's probably a lot to do with workload and funding, etc. So it would be great if we could, I guess, get more investment into that to kind of bring us up to speed with where other industries maybe are.
Yeah, absolutely. Not a question for Caroline. I'm coming to you, Nihar, in a second, but Caroline's just making a comment. She says, I think the training and development opportunities people have in the NHS is amazing. The key for me is our attraction and recruitment in the first place. We need to focus on the candidate experience and raise our profile, particularly for support roles. We're so behind the curve and not attracting young people into our workforce because of this. We need to invest in this to make the shift change needed. I think that echoes a little bit of what our first speaker was saying. But Nihar, you're an economist, and I love facts and figures and data and things like that. And I know that data is really valuable within the NHS at the minute. But tell us about the Real Centre's findings of the workforce projections up to 2030, which I think was focused on registered nurses and GP nursing. What were the key findings?
Thanks, Helen. Yes, indeed. So I work for the Real Centre, which for those who don't know is part of the Health Foundation, which is a charity that works to improve health across the UK. So we published our first set of workforce projections for the NHS last year. We had high-level numbers of workforce supply and demand through to 2030, as you mentioned, Helen. And within that, we focused on nursing and general practice as being areas of particular pressure. So in a nutshell, what we found was we had three scenarios: current policy, and a more optimistic and a more pessimistic scenario. And we found that under current policy, the shortages that we're seeing in the NHS by any measure at the moment are likely to persist. In the longer term, we don't have any scope really of supply meeting even a conservative estimate of demand across the system. It's only in a more optimistic scenario where you have policy action on international recruitment, but also staff retention and domestic training. So if all of those work hand in hand and go in the right direction, that's the only scenario where there is a chance of supply meeting demand, and only then by the end of the decade. So we emphasize that it's a long-term process which needs a long-term, fully funded workforce strategy. And it's encouraging that the government is committed to one later this year. So we're keenly awaiting that. But even if that comes out, I think it leaves quite a few questions open from our wider planning perspective. So one of the things we found was necessary was joined up thinking across the system, because even in that optimistic scenario I mentioned, the shortage between supply and demand is likely to be met hospital sector, not necessarily for general practice, and under our projections, not for social care nursing as well. So one of the key findings was to kind of have comprehensive thinking across the system of the implications of workforce planning for the NHS on social care, on general practice, on other areas, and what the implications might be for workforce turnover. So are there people who are likely to move around more across those areas as a result of policies targeting better kind of outcomes for the NHS workforce specifically? So that's one thing to consider. And I guess the other thing is funding. It's very important that any measures put in place are backed by a lot of funding. And I think that's what is in the news at the moment. So how can we ensure that training places that are committed to are funded? How can we ensure that international recruitment is ethical? And how can we ensure that people go to the right places? So one of the things we looked at was the kind of variation by region and specialty. That's not something our projections focus on, but we acknowledge that any shortfall measures at the national level are likely to be very different at regional level and local level, and also across branches and specialties. So that's something for the workforce plan to consider. How do we ensure that we move away from top level targets towards a system where we're considering local requirements and very specific policies for specific areas? So one example is international recruitment. That's been in the news of late as being one way to address the shortfall in the short term. But what we found in nursing, which Caroline rightly emphasized, is that a lot of that goes to the acute sector, and it doesn't really make much of a dent for community nursing and general practice. So if you want improvements in those areas, we can't just look at international. We have to look at better retention in the short term. That's really the only way to kind of plug the gap, and in the longer term ensure that we invest enough in domestic training and education.
You answered about 4 of my questions actually that I've got coming up for you in that. So that was all very, very full and which great. But that report, Samir, does make pretty sobering reading. And, we don't want to not be optimistic, but, it seems this problem isn't going to go away very easily. So how can we attract the right people for the many vacancies? How can we, she says, asking about 10 questions in one, how can we also attract young people? And should the NHS rely on outside agencies to help meet those demands? Oh, your microphone's off. Samir, let's just get you up on microphone.
Yes.
I think you're back on now. Yep, there you are. Microphone's back on.
Thank you very much. So yes, quite a few questions here. So the agencies, starting with your last point, I think, in a nutshell, again, we could talk about this for hours, but I think, agencies are not going to disappear. There are, however, tools to make sure that we only rely on agencies for roles we absolutely have to. So, in my view, and I hope our colleagues in the agency space will not take any offense of that, but in my view, we should have there are all kinds of tools available right now, which, by the way, don't require any investment, things that are just there off the shelf for people to start using, which require probably more of a mindset change rather than actual investment. So being able to recycle talent, the usage of talent banks, the usage of, we talked a lot about creating a pipeline effectively. So Nihar, you were talking about international recruitment, right? We do all those events. What happens with those contacts we make? How do we keep them going? How do we keep them engaged? How do we identify them? So essentially all kind of tools that are there, CRM, automated talent banking, which are pretty much plug and play, which enable organizations when they are looking for candidates to look at people they have already been in touch with in the past. And obviously all of this being done ethically, in line with diversity practices and all of this. Your second point, Helen, was around attracting candidates. And I think when it comes to that, the NHS is very much, and again, I hope no one's going to take offense, but when we look at the NHS globally and you compare them to the average recruiter in the private sector world, for example, you'll notice a big difference. Budgets in the NHS are tiny, I get that. That being said, engaging candidates, being able to make sure that we inform candidates, talking about, I think Caroline was talking about the candidate experience, making sure we talk to them where they are. So, aligning to their channels of communication, making sure we answer their questions and we provide them with a personalized experience through websites that, let's go crazy, might also look good and offer them all kind of engaging content. All those tools are, again, things that can be done with very, very little investments. We're not talking about, tons and tons of money. I think it's the biggest myth that we hear about. All those kind of tools help ensure that people will consider the NHS as an employer of choice. We work with quite a few NHS trusts, and just by essentially talking to them, interviewing them, understanding what their value proposition is, we're able to display that value proposition to the right candidates at the right stage. And it takes no work, no investment. So lots of things can be done to very much personalize this experience. 20 years ago, it was good enough to put an ad out there and have candidates fight for it. It doesn't work that way anymore. Yeah. People get tons and tons of offers, especially in this market. Talent is scarce. The challenges the NHS is facing, everybody faces them. Other sectors might have a little bit more cash to throw at the problems. So our recommendation would be, well, let's be smart. And there are some good things the NHS is in a unique position to do, by the way, when it comes to that. Automation is something that can really, really help the NHS, in my view, progress, do things faster, and focus on the value-add activities, which are engaging candidates and ensuring their experience. Was there anything else?
No, that's fine. I'm going to bring Will back into the conversation. I mean, we need effective solutions, don't we, Will? And do you want to build on what Samir said there about, what solutions you think are out there and what really works?
Well, I don't want to come across as an advocate for agencies, but I do think there's a few misrepresentations. when we're trying to talk at the same time about making the NHS an attractive place to work and the NHS reliance, which has been persistent for decades now, on agency workers, we forget that almost all agency workers are either current or former NHS employees. And one of the reasons why they become agency workers is to get advantages, either in terms of where they work or when they work, that aren't always available to substantive staff. So I agree with Samir that there are things that could be done in what he called the value proposition for permanent staff that reflect what worker preferences actually are. And I think that that's also quite an important point because the same thing applies in the agency market, Helen, as you mentioned before, is clinical agency workers have alternative employers than the NHS. And I think that the NHS needs to be careful that it doesn't effectively demonize a sector that it's quite reliant on, to the extent that it ends up choking what is it, certainly in the short term, quite an important component of its supply structure. And it's also true that if when you speak to agency workers, you will hear very different experiences of preferences for one hospital over another or one department over another, different experiences of how included they feel in the clinical teams they're working for, some good experiences and some less good. So I think we have to acknowledge that agency supply is a part of NHS supply. And in fact, and this is the last point I'll make, because trusts are, and this has been the case for many, many years now, encouraged to reduce their agency reliance, going back to the earlier point I made about data and demand patterns, that means that often you end up creating emergency demand for agencies because it's not something you're planning for. And if you're in an emergency demand situation, the pool of workers available to you and the price at which they will be prepared to work might mean that you end up exacerbating the agency problem that you thought you were resolving by limiting your demand. And one of the things that is extremely important, and the NHS England has a focus on this, is that if there is emergency demand for agencies that becomes harder to fill, then trusts will end up using suppliers that are not regulated on any framework agreement, and those that are need to comply with a lot of quality assurance, which of course is all rooted in patient safety. So I think there's just something about being honest about what the role of contingent labour is in the NHS, rather than thinking of contingent labour itself as a problem.
Thank you very much, Will. I mean, Lisa, Samir said there, it's not always all about money. How do we encourage more people to look at the NHS as a worthwhile career? I've been lucky in my career. I've worked quite a lot with the London Ambulance Service, also the Air Ambulance in London. And there's more to it, isn't there, about, obviously we all need to pay our bills and support families, but how can you get that message across? Because I would imagine working in the ambulance service and other areas of the NHS is hugely rewarding.
100%. And I think this probably goes probably across the whole NHS. I do think we need a little bit of a rebrand, if I'm honest. The amount of times we've been in the press, particularly probably in the last few winters, it's pretty exhausting, the negativity that is around the NHS, when actually there's amazing work goes on every single day, and so many people have lifelong, rewarding, valuable careers that they enjoy. And that's not to be overly optimistic and to cloud over any of the challenges, but I think it's about putting it into a little bit of perspective that yes, there are enormous challenges, and it's not being naive to them, but it's actually that there's huge benefits too about this career. And I do just wonder about, kids that are growing up today, seeing this stuff just every day about the negativity around the NHS. That must be filtering into them. Why would they want to be a nurse, or why would they want to be a doctor or a paramedic? Because it doesn't look great from the outside. So I guess I think some of the narrative needs to change around all of that, as well as obviously huge systemic kind of issues that need to be addressed. But it is, I think you're right, it's the two together, and it's probably just getting some of that good news stuff out as well.
The narrative is so important. It is actually, Lisa, something we see in the rail conferences that we also host with this same organisation, because rail is completely rebranded and tried to explain to particularly children in the classroom, you know, the opportunities in engineering and digital and not just driving a train. And so, yeah, I think you're right. If some of those great real life stories could get out there, that would definitely help anyway. Neha, I'm just looking, Donna says, is it possible to share the link for the workforce projection? So I'm presuming perhaps with our team behind the scenes, it might be possible to make the real figures that you mentioned in your first answer available to people on the conference, which would be great. Obviously, Neha, there isn't a silver bullet solution to the shortages, but have you engaged with government and other stakeholders on NHS workforce planning? And if so, how is that going?
Yes, absolutely. I fully agree with the points that Smear, Will, and Lisa have made so far. I think there's a real need to think about the image of a career in the NHS, what it implies, and how it compares, and how that kind of comparison can be improved in favor of the NHS, and also to do the same for social care. So yes, we have been engaging with stakeholders across the system, the NHS, government stakeholders, unions, everyone who feeds into this process, and trying to think of how that could kind of be made a reality. I guess it's safe to say that this is all work in progress. The upcoming workforce plan will be the first, hopefully, of many iterations, because it's going to be an iterative process. And I think there's a lot to think about in terms of the factors that have been raised, in terms of how we can bring kind of pay and progression into wider workforce planning. So at the moment, the pay review process seems to be a bit disjointed from overall workforce planning, which probably cannot continue given the cost of living crisis that we've seen. As you've said, that's contributed to the image of a career in the NHS kind of falling behind, arguably slightly relative to other parts of the economy. So how we bring that in, how we have that open conversation about pay as well as career progression, motivation, all the other factors that feed into workforce morale and workload and burnout. Those things are important to consider, as we've seen from the staff survey. So yes, we're having those conversations. We'll continue to have them going forward, and hopefully there'll be more scope, I guess, for joined up conversations across the system, which to some extent the Health Foundation is facilitated. But I think there's increasing recognition that that needs to happen across the board as well.
Brilliant. We've only got a couple of minutes left. The clock always runs away with me, so we'll just go for a few short answers, if that's okay. Samir, what does a good candidate experience look like in your eyes? Oh, your mic's gone again. Let's just put your mic on. Okay, you're back with us.
Yes.
So what does a good candidate experience look like, Samir? Just a short answer if we can, because we're nearing the end.
Engaging, personalized, automated.
That was a really short answer. Will's nodding away there. Okay. And Will, a question from Dimitri. What factors do you attribute to low retention rates, particularly among internationally recruited staff? Is that something you can take on, Will?
I saw the question and I've been thinking about it. I don't have access to any data about that right now, and I don't want to just give a speculative answer about why it might be the case. So by all means, share my contact details with Dimitri, and I will try to follow up behind the scenes.
Perfect. Lisa, what can we learn from and implement from other industries, do you think?
Oh, that's a huge question that I'm not going to be able to give you a short answer for. I think I kind of said it before, innovation. I think we just need to be thinking outside the box. And I think we're generally not that great at that.
Okay. And Neha, you mentioned a little bit about different regions and different sectors. To what extent did you find that the results varied between different, by region and by sector?
So yes, we didn't publish results separately by region and sector, but we did some modeling behind the scenes, and we found that there's considerable variation. So both in terms of demand and supply, the kind of dynamics in different regions and sectors are very, very different. As I said, one example is acute versus the other specialties in nursing, where international tends to flow mostly to acute. And the flip side of that is internationals becoming a much more competitive market. So we're seeing evidence of other countries who are starting to compete much more actively with the UK in international recruitment. So we have to think seriously about whether that will be a sustainable channel going forward.
And just finally, Lisa, briefly, of course, we've got to engage with communities as well, and that's a big part of things too, isn't it?
Yeah, absolutely. And I think that's something that hopefully we've done well at the ambulance service. I think because we are essentially based in every community in Scotland by the nature of our organisation, it means that we are kind of there at the grassroots, and we've found that really successful in the last few years to really get in there to the local communities. And I guess community as well as in general in terms of your qualities, things like age. I often find that age is kind of overlooked in terms of this, but so many people tell me that they're too old to have a career in the NHS, and it's just nonsense, actually. And I think it's part of all this that there is a role for everyone. If you're interested in working with us, it's just a case of how you can best fit into that, really.
Oh, it's so right. We're all the same person underneath, aren't we? We just come with experience and wisdom as we get our grey hairs and get older. She says that's feeling like an older person now. Time always runs away with me. You've been fantastic panelists. I'd like to say thank you very much to Samir, to Lisa, Will and Neha for starting off the day with such engaging conversation on the challenges within the NHS and sharing some of their experiences. We'll take a very short break now, time to absorb what we've heard so far. If you have a chance to engage with the speed networking functionality, perhaps use what you've learned this morning as an icebreaker. Let's meet back here at 10:40. Perfect.